Hello everyone. In today's video, we're going to answer the question, Medicare and Medicaid, are they the same thing? And we're going to talk about the differences of Medicare and Medicaid. By the end of this video, you're going to know exactly the difference, and let's get right into it. So the first question is Medicare and Medicaid the same thing? And the answer is no, they're not the same thing. A lot of individuals get them confused because they sound very similar and they are both health insurance, okay? So let's start out with what is Medicare. So Medicare is regulated by the federal government. So all of the rules when it comes to Medicare is exactly the same from state to state. So how to get on Medicare, how to apply for Medicare, the rules of Medicare, all of that is going to be the same whether you're in New York, Florida, Alaska, doesn't matter. It's going to be the same because it's regulated by the federal government. So Medicare is health insurance for individuals turning 65, or if you have a qualifying disability and you receive SSDI, you will get Medicare after 24 months. So you get Medicare at the age of 65. You earn this health insurance, right? You earn this benefit from working in the US for 10 years, 40 quarters, paying Medicare taxes. If you look at your pay stub, you will see Medicare as one of the taxes that you pay. So this is what you're paying for. So Medicare has two parts. Like I said, Medicare is health insurance. You have Medicare Part A, which is your hospital coverage. You have Medicare Part B, which is your medical coverage. And you also can enroll in Medicare Part D for your prescription drug coverage. So there's different parts, okay? So how do you apply for Medicare? So you could apply for Medicare via Social Security. You could go to your local office or you could call Social Security directly and set up an appointment, okay? And you could also go online, ssa.gov, create an account. It will also let you know if you are eligible for Medicare. Do you have the 10 years of working credits? Do you have your 40 credits, okay? So yeah, if you go online, ssa.gov, you would know from there if you qualify for Medicare or not. A lot of individuals are 65, but they don't have enough working credits, okay? So that's how that works, okay? That's how you apply. Like I said, Medicare is regulated by the federal government. So let's talk about the things that Medicare do cover. So like I said, there's two parts. You have your hospital coverage and you have your medical coverage. So Medicare will cover 80% when it comes to your medical, right? Now, that means that you're responsible for 20%. So a lot of individuals will add on a Medicare supplement plan that will help with that 20%, or they would get on a Medicare Advantage plan. With that, it replaces original Medicare and you have copays within your plan, okay? Some of the things that Medicare does not cover, and we're talking about original Medicare here, we're not talking about a Medicare supplement or a Medicare Advantage plan. It would be dental. Original Medicare does not cover dental. It covers very little, but not your regular routine dental cleaning, exams, and such. It doesn't cover hearing, and it doesn't cover vision as well. And it does not cover long-term care. A lot of individuals think that Medicare covers long-term care because Medicare is for individuals turning 65, right? So it would make sense that it covers long-term care, but it does not. Medicare does not cover long-term care. What Medicare covers is skilled nursing care. So what is skilled nursing? Skilled nursing is when you're getting care that is required by a registered nurse or a licensed therapist, such as IV medication, such as you needing therapy to get stronger after a stroke or a heart condition and things like that. So it covers skilled nursing care. It does not cover long-term care. Long-term care is for individuals that need assistance long-term, meaning that you need everyday help for your everyday daily activities such as eating, bathing, dressing, getting in and out of bed, walking. You need help with, like your everyday life, things that individuals take for granted every day. These are individuals that need help every single day to just be well and to be alive. That is considered long-term care. Now, if you get admitted to a nursing facility because you need long-term care, remember Medicare does not cover long-term care. You will have to have a long-term care policy or Medicaid, and we're going to talk about Medicaid next. All right, so what is Medicaid? Medicaid is health insurance as well, regulated by the federal government and regulated by individual states. So the rules would be different from state to state, right? Medicare is a little different, regulated by the government. When it comes to Medicaid, it depends on your particular state. So the rules in Georgia may be a little different from the rules in New York or the rules in Florida, right? So how do you apply for Medicaid? Medicaid is based on low income and limited resources. So an individual will have to be low income to get on Medicaid, and other criteria as well, such as if you're an elderly, so this is someone that's 65, if you're pregnant, if you have young children. These are the individuals that usually qualify for Medicaid. In certain states, men can apply for Medicaid as well. Certain states, men cannot. If you are a healthy male individual, a lot of states, you cannot qualify for Medicaid. Medicaid is also available for low-income families as well. So sometimes the mother that's pregnant would be on Medicaid and the father would be on Medicaid as well, because it's also for low-income families, depending on the state. Of course, every state have their own rules and their own requirements, but for sure across the board, it's going to be for individuals such as mothers, the elderly that is low income and has limited resources. So what is limited resources? You can have about $9,000 or so in the bank, depending on the state, of course. You can have one house and you can have one car, and you have to be considered low income, okay? So depending on the state would determine if you qualify, if you're considered low income, okay? So that is Medicaid. Now, how do you apply for Medicaid? You have to go through your particular state. Every state, Medicaid is called different, right? Every website is going to be a little different. So like Florida, the website to apply for Medicaid is called Florida Access, and our Medicaid card is a gold card. In the state of Georgia, it's going to be called something else. In the state of California, it's called Medi-Cal. So depending on your state, Medicaid is called something different. Like I said, every state have different requirements. Now, what do Medicaid cover? So Medicaid cover medical, right? So it covers health insurance. It's going to be a little different. It's not going to have different parts, but for the most part, it's going to cover medical insurance. Now, Medicaid will cover dental. However, it's really hard to find a dentist that takes Medicaid, okay? Also, Medicaid does cover long-term care. Remember in the beginning of the video when I talked about Medicare, I said that Medicare does not cover long-term care. Medicaid, however, does cover long-term care. Now let's talk about, can you have both Medicare and can you have Medicaid? And the answer is, if you qualify for both, then you can have both. So let's talk about an individual that is 65, that is low income, that has Medicare. Can that individual apply for Medicaid? Absolutely yes. If they meet the income requirements and the limited resources requirement, then they can have both. Now, what is the benefit of having both Medicare and Medicaid? Medicaid will pay your Medicare Part B premium for you. So that is really nice. And depending on the state, you could enroll in a Medicare Advantage plan that is specified for individuals for both Medicare and Medicaid. These plans are called DSNPs. These are dual special needs plans for individuals that have both Medicare and Medicaid. The hint word dual, so that means that they have both. Now, when you enroll in a dual plan, most likely, depending on your state, disclaimer, all of these dual plans are not available in all states, but certain states, they offer these dual plans. These dual plans are offered by different health insurance companies such as United Healthcare, Humana, Cigna, Aetna, WellCare, and such. Now, it depends on the state that you live in. They're not offered in every state. And a lot of times, depending on the plan itself, it does offer extra perks such as healthy foods, transportation, and such. And the reason why they offer healthy foods is to help you stay out of the hospital, to help you stay healthy. So there's a lot of benefits to get on a dual plan. Like I said, you need Medicare and you need Medicaid. So that is it for today's video. I hope I made it really clear on the difference between Medicare and Medicaid. How can you apply for both if you qualify for both and such? If you have any questions, comments, or concerns, please let me know in the comment section below, and I'd be more than happy to answer your question. If you know anyone that needs this information, please share this video with a friend. If you're not subscribed to the channel, please subscribe. And of course, if you need any assistance with any of this information, give our office a call. We'd be more than happy to assist. We never charge for our services. Thank you so much for watching, and I'll see you on the next video. Bye for now. Bye.